Hi, I'm Dr Luke Mooney, knee and hip reconstruction replacement surgeon at Orthopaedics 360 in Adelaide. Today, I wanted to give you some information on how to manage dressings following your surgery. My philosophy is to create an ideal environment for wound healing and to prevent any wound healing problems. For nearly all surgeries, I utilise dissolving sutures under the skin to close the surgical incision. This means that there is no sutures or stitches required for removal during the post-operative phase of your recovery. Once the skin is closed, I use a waterproof dressing to improve the comfort and convenience for you during your recovery. What we know is that wounds require just enough moisture to encourage healing of the wound. This means that dressings that trap moisture can be too wet and can cause maceration to the wound. Alternatively, dressings that remove all the moisture from the wound can dry the wound. This is not ideal for adequate wound healing. Under the waterproof layer, I use a wound support dressing such as Hyperfix. This removes any tension from the wound when your knee or hip is being moved. The day following surgery, the dressings can be splashed wet in the shower. After the shower, the dressings should be pat dry and inspected for any leak. Thankfully, leaking under the dressing is extremely rare. If it does occur, I'd recommend changing the waterproof layer to prevent this from occurring again. In the recovery from surgery, topical ice treatments can be used for 20 minutes at a time throughout the day, particularly in the first 72 hours after surgery, and this really helps prevent swelling and pain. Ice covered with a protective layer such as a dry towel can be applied directly to the waterproof layer on the skin. Should the corners of the waterproof layer lift, I'd recommend using clean scissors to trim these edges. This helps prevent them from catching and lifting further. Occasionally, application of dressing tape may also help prevent further lifting. This can be obtained from a pharmacy or chemist near you. After the early recovery has occurred, we'll arrange a wound review appointment in my clinic to inspect the wounds and remove the waterproof layer. Often we reapply a Hyperfix layer to provide further wound support, and this assists in minimising any stretching of the scar. The wound will complete its healing over the first 6 weeks. Thank you for joining me today to hear about dressing management following your surgery. Please contact my office if there are any concerns. Please subscribe to our YouTube channel to see further videos as they're released. Please also connect with us on Instagram and Facebook. Thank you, and I look forward to seeing you at the next video.